Hey guys, Dr. Berner with Foundation Chiropractic. Today I want to talk about the automatic operating system, just like your iPhones, okay? So we're given this ability to heal from the inside out, starting with the nerve system, with the brain. The brain will send signals from here down through the upper cervical spine, the top of the neck, and then it goes to all the organs to tell it what to do. The information will come from the brain, down the spinal cord, down the spine as well too, and out to these organs automatically. When you're sleeping at night, do you control your own breath? Your body will do that by itself. So, of course, we want to focus on correcting secondary conditions, headaches, migraines, neck pain, but in turn, we want to look for a more broader, more healthier mindset function of the body. So, lower stress levels, digestion, heart issues, breathing problems. This is what health is about. Now, in order for this to operate the way it's supposed to, our spine needs to be in the proper position. So when we look at our spine on the side, we need to have 3 curves to our back, with the ear evenly over the shoulder, over the hip, knee, and ankle. When our spine is in this position, the body has the potential to heal and function the way it's supposed to. When you're looking at your spine front to back, no scoliosis should be there, which is the lateral deviation of the spine. Now I'm going to sit down and show you exactly what normal spine should look like. Okay, so let's go over what a normal spine is and an abnormal spine. How strong is your foundation? On the left side, I'm going to write normal. On the right side is going to be abnormal. This is the spine on the side. Again, we want to make sure we have these nice, healthy curves. The ear over the shoulder, hip, knee, and ankle. Now, why do we need these curves on the side? The reason is that our head is a bowling ball. It weighs on average 12 pounds. At the upper cervical spine, which means the top of the neck, there's a little bone here called the atlas bone. Atlas, like the Greek Titan holding up the globe, your atlas is holding up your globe, which is your brain. Very important. Or cervical 1 or C1. The head is 12 pounds because of the skull, the tissue, the brain material. The atlas bone, believe it or not, is only 2 ounces. Now, why is this segment so small and why does it weigh so much? So we can move our head around. Almost all the range of motion of our head and neck is done by this upper bone right here. So if it moves the most, it's going to shift the most as well. So this is normal. When our spine is in this proper position, the body has the potential to heal and function the way it's supposed to. Now let's check out abnormal. Look how far forward the ear is. Let's pretend the ear is right here. The shoulder is way back here. So this distance, okay, of where the ear should be, according to research, every 1 inch of the ear over the shoulder theoretically adds about 10 more pounds of pressure on top of the spine. So your bowling ball head is not just 12 pounds, it can be adding up to 10 more or even 10 more, over 30 pounds of abnormal leverage going down the spine. This leads to that granny hump that people get as they age, similar to a seesaw. Here's a seesaw right here. If there's extra weight on this side going down, the body's going to counteract that and add more weight over here. It does that by adding that granny hump right here. So we call this anterior head syndrome. It's going to damage the vertebrae right here, causing degenerative disc disease, causing pinched nerves, abnormal muscle tension, disc herniations, and then a laundry list of secondary problems like headaches, neck pain, even lower back pain too can be affected. So we want to make sure that we avoid this. If there's already degeneration going on in the spine, unfortunately arthritis is permanent. We need to do the best we can to be proactive and stop the progression from getting worse, so we end up more like the normal spine and our body and health can be 100% normal and function the way it's supposed to. So how strong is your foundation? Have someone look at the side of you and see how far your ear is over your shoulder and let us know in the comments below.